Welcome, welcome, welcome to Health Issues. I'm your host, Sylvain, and we are truly excited today. We have a show that is so particular and special to the city of New Orleans. New Orleans is known for great food and great music and, you know, a lot of things. But one thing that it is known, maybe not known for, but that it is one of the top cities, in fact, number 5 in the rates of HIV infection, where people are affected with HIV infected. And so we have 2 great guests. Believe me, I couldn't think of any better. We have Miss Erica Sugimori. She's a health planner with the New Orleans Regional AIDS Planning Council, and we're excited to have her. And we actually have the program director, Miss Brandi Bowen, with the New Orleans Regional AIDS Planning Council. Welcome.
Thank you.
Thank you.
We're excited to have you both. Before we even get started, let's discuss a big picture of HIV in the city of New Orleans, the impact.
Absolutely. Well, I'd like to start by sharing a little bit about the Planning Council, who we are and what we do.
Good.
The New Orleans Regional AIDS Planning Council is the public planning body for the Ryan White HIV services in the New Orleans area.
Okay.
We serve as the planning arm for the Office of Health Policy, which is a division of the New Orleans Health Department.
Okay.
The City of New Orleans receives $7 million from the Health Resources Services Administration under the Department of Health and Hospitals at the national level.
Okay.
So the Office of Health Policy administers those funds while our Planning Council makes decisions around the priority service categories, how much funding goes to those categories, the standards of care that need to be delivered to the patients. And as we see in our role as the planning body and as the planning support staff, we've got a very serious issue with HIV here in the New Orleans area.
Got it.
Yeah, as you had mentioned in your introduction, the New Orleans area metropolitan area, which is several parishes in that group, is number 5 in terms of AIDS case rates for 2010, as per the most recent report by the Centers for Disease Control.
Okay.
And it really is an issue statewide. Louisiana has terrible rates for sexually transmitted diseases. We're number 1 for primary and secondary syphilis, 2 for gonorrhea, and 3 for chlamydia. And then, of
That's
course,
Louisiana or New Orleans?
That's Louisiana. Okay. And then, as far as metropolitan areas, Baton Rouge is right up there with us in AIDS case rates at number 1. So certainly, statewide and locally, HIV is a huge issue.
So that means that there are over 7,000 people living with HIV here in the New Orleans area. We know that just less than 70% of them see their doctor regularly each year, which means that there's over 2,000 people each year who never see a doctor. We also know from the Centers for Disease Control estimates that there's probably another 20% of people who don't know that they're living with HIV, or about 2,500 people in the area who have not yet been tested.
Okay, just why is New Orleans high? I mean, we understand cardiovascular disease and high blood pressure because of the food, and we understand you know, diabetes because of the, you know, the chicken and the greens, not the greens, but the chicken and the white bread and white rice, all right, and the saints or whatever. But why is New Orleans high in HIV?
And the data shows that there are probably many reasons that play into that. Everything ranging from the stigma issues that we still experience here in the South, discrimination.
Let's stop right there. Stigma issues. Why does New Orleans, as opposed to Seattle, Washington, why is New Orleans, what about the stigma issues makes New Orleans?
Well, Well, it's a difficult thing to talk about for people, it seems, that with HIV disease so often being connected with sexual behaviors or one's lifestyle, that it's in some ways feels to be taboo, that if somebody's living with HIV, then perhaps they've done something wrong to get it, versus a disease like hepatitis C or breast cancer, where the person who's living with that disease isn't seen necessarily in the same way.
No, but why isn't it? It's difficult to talk about in Topeka, Kansas.
Well, I'm sure that Topeka, Kansas has its own cultural situation, but of course, you know, here we've got something of a paradox of a culture, you know, that we love to live big, easy style, but we also tend to be very conservative in our views simultaneously, ironically enough.
So that means that we have a lot of down low, undercover. We're big, easy, but we want to be conservative to not deal with it. Is that?
So as an example, we do not currently require comprehensive sexual health education in the schools in Louisiana.
Okay.
That there are, you know, policies in place that suggest that those conversations should take place at the home, which of course at home is where conversations like that can take place, but not the only place that people should be able to get that education. And if those conversations are not happening elsewhere with informed health professionals, the opportunity for our youth to get that education in the schools we feel is very important, particularly when we look at the statistics among new diagnoses among our youth.
So you actually, let me get this straight. When we pass down on the boulevard, we have big billboards about visions in the Larry Flint Club in Bourbon Street. Do they play a part in having New Orleans at number 5?
They may, but what you don't often see enough on the boulevard are the billboards saying, wrap it up, protect yourself, know your status. So, you know, clubs like that can afford the advertising, whereas the funding that's available for both HIV prevention and care services is so limited that there's never really enough to get the word out to the community as often and consistently as we need to.
But you also mentioned the paradox, and Ms. Bowen, you can see she's humanities all over. I like to see humanities great. Okay, but the paradox is we're very probably in one of the most conservative states. Was that red state or blue state, whatever it is?
Right.
All right, but one of the most conservative states in the nation. So we have Bourbon Street, but we have conservative legislators. Now I can't figure that out, but does that have something to do with it?
I think it may, because the efforts of advocates to try to make comprehensive sexual education at age-appropriate levels in the schools mandatory, those efforts have not yet come to fruition. That statewide, we really need our legislators to understand the importance of education and information in order to reduce the risk factors. And when people say, well, no, we just don't want to talk about that, we just don't want our kids hearing about it, it absolutely fuels the spread of the disease, I believe.
Okay, well, let's flip it on the other side. Okay, for those conservative or not or whatever, say that sex outside of marriage is wrong. Period. They believe that it is wrong. Folk on Bourbon Street can do whatever they want to do, but sex outside of marriage is wrong. And so therefore, if sex outside of marriage is wrong, why should governmental dollars be spent teaching people how to handle sex outside of marriage?
Well, the impact on the public health system is huge. The cost of somebody living with HIV, if there's not medications available, if there's not care and treatment or case management and those supportive services available, that can result in a huge burden on the community to try to be able to make sure that those people are able to live healthy lives with dignity. So in the absence of those services, I believe we'd have a much larger public health issue than we already do. Personally, I don't feel that it's my place to pass judgment on what other informed consensual adults may choose to do, but what I think is important is that everybody is able to have the necessary education and information to protect themselves, to know their risk factors, to understand how to protect themselves, and to know that they should get an HIV test every year.
Let's push it even further, okay? Say I don't believe, say if a person doesn't believe that they believe that sex outside of marriage is totally wrong, so therefore, if somebody wants to engage in behaviors that's going to put them at risk, again, that's right. That's totally up to them, and they should do it with their own money. Shouldn't have to do it with anybody else's money. They're on their own. We'll leave that alone. Okay.
That's a good one, though. Yeah. Well, you know, I'm a believer in that if somebody has become homeless, that we should have housing services available to them.
That's different. That's a safety net.
The HIV care and services can be seen as a safety net as well. And particularly as we get excited about opportunities to expand insurance coverage, we're hopeful that people will have greater and greater access to the care and treatment, because historically they've been discriminated against in their efforts to get insurance. So if they need medications for a month and they just simply can't afford them, you know, there are ways that people can.
Don't get me wrong, we're speaking about comprehensive sex education,
right?
Quote-unquote condom distribution, because the only educational message that usually comes out when people speak about comprehensive sex education is distribution of condoms to unmarried folk. You know what I mean? That's usually the beginning and the end of the message. And then secondly, the question everybody asks is, where's the data to show that it's going to move New Orleans from number 5 down to number 90, you know, East Baton Rouge from number 1 to number 90, when in fact the other side is saying, how about this? If we change the culture and the behavior to abstinence, then we can move from number 1 to number.
So I think you've touched on a lot of important points there. First, I'd like to say that I see comprehensive sexual education as being much more than simply condom distribution, that it can include an explanation of HIV 101, the life cycle of the disease, how it's transmitted, how it works, the fact that you cannot get it from a mosquito, you cannot get it from a toilet seat, so that people know what the risk factors are, what 4 bodily fluids need to have contact to be able to transmit the virus. So I think there's a lot more to that education than simply distributing condoms. I think also important in the use of condoms is to remember that they've got to be used consistently 100% of the time and properly. So to make them effective, they've really got to be used the way that they need to be. But I really want to touch on your other topic here, which is, you know, the entire culture of, you know, HIV is not a disease that just lives in a body, it lives within all of society, and how society interacts that can fuel that spread. And the importance of the whole community working together. That to be able to, it's my hope that we truly can achieve an AIDS-free generation, that we can end this epidemic. But I think you're right, it's going to take so much more than government resources alone, so much more than social service programs or simply safety nets, that it's going to take every member of our community taking responsibility for knowing their own status, for protecting themselves, for having conversations with their partner, for talking to their children or their grandchildren or their grandmother or their mother, and being open to these conversations rather than keeping them quiet and in the dark. Okay,
issue then. The people that are getting AIDS, the face of AIDS has changed.
That's right.
Let's talk about that a little bit.
Well, a little bit about that. Like we had discussed earlier, in the beginning of the epidemic, more than 30 years ago now, it was really the demographic or the face of AIDS was gay white males. Now, over time, there's been a huge shift with that, and now we're seeing that the face of AIDS may be an African American female. Certainly, minority groups and marginalized communities are most heavily impacted. Youth, the ages 13 to 24, since 2007, we see those rates climbing as far as new infections. So it's certainly an issue that has changed over time, and we're having, especially in our majority community, having really to address and tailor our messages and our work to these populations.
If you had all the money in the world, what would you do?
That's an excellent question.
Yeah, all the money in the world would be fabulous.
There's so much to be done. I mean, you've talked about the other structural factors that are connected to HIV, but not always necessarily within the direct realm of our work. The considerations around substance use in the community, making sure that there's adequate and appropriate mental health treatment. I've seen extensive data studies that show the connection between housing stability and risk factors, both for for becoming infected with HIV, as well as whether or not somebody's stable in their care, and their housing stability really plays into that. So being able to build up the community as a whole, to be able to improve income levels, educational opportunities, to empower the community to look at these issues in a more holistic manner and make sure that we're addressing the needs of the whole person as well as the whole community.
See, but that's what the abstinence community is saying. Like, condom distribution doesn't deal with the real root cause, because if we can deal with people's self-esteem and who they are, all right, then we can deal with then at that point we're dealing with prostitution, we're dealing with multiple sex partners, we're dealing with all of these issues that destroy relationships and monogamous relationships because of, you know, these outside pressures. So let's focus on creating monogamous, you know what I mean, contractually marriages, and you know what I mean, and then we've reduced the risk. Let me throw this out. Isn't it a risk factor? Isn't multiple sex partners a risk factor in and of itself for contracting AIDS?
Certainly, especially if with a highly active sexual life, you may find yourself in different, whatever the cause is or reason behind somebody's multiple partners, there may be less condom usage, less safe sex, maybe even substance abuse involved. And when we find those things all in combination, the likelihood of somebody engaging in unsafe sex is higher. And same along those lines, if one person becomes infected within that social network, it can easily spread within that population.
Yeah, but I was actually bringing to, I mean, and with you that in and of itself, if we keep everything else constant, the human body, when a human body has multiple sex partners, in and of itself is more highly likely that that person can contract AIDS. It's almost as if the body knows whether a person is engaged with multiple sex partners or monogamous, because it increases their likelihood of AIDS transmission.
And I think that has more to do with, again, all the other encompassing factors that go along with that multiple sex partner type culture. You were talking about behavior and culture. And so certainly high promiscuity can lead to that kind of situation.
All right, now let's flip this around again. Who's getting it? It's we said the face of AIDS have changed, more African American males, but still, I guess some basics. If an African American female, or any female gets HIV, is more likely coming from a man,
Right.
as opposed to like if a man get HIV, it's more likely that he got it through men having sex with men.
But in terms of who we're seeing the new cases among, I just have to remind us all that HIV does not discriminate. So what we've seen recently is that among new cases, 25% are among the youth under the age of 24.
Right.
We've seen 25% of new cases, or an estimated 25%, in those over the age of 55.
Right.
So some people might not realize their risk factors. But if you're having unprotected sex with anyone even one time, you could potentially be exposed if you don't know your partner's status.
Well, let's throw this out again. Is there any data to show, any data to show that that condom distribution and condom use actually decreases the rate of infection substantially? Let's put it to you that way. And when I say, of course, 100%, but we know that anybody have attempted to stop pregnancy using condoms, they usually know after about a year or two that doesn't work, because you know condoms don't do well to stop pregnancy. So the question is, why would we think condoms are any more effective at stopping HIV?
Well, I may have missed some bridged research. However, condom use, again, used in a specific research setting, used 100% of the time and perfectly 100% of the time, it has shown to markedly reduce the transmission.
Cool.
Also, condom distribution is a well-studied intervention, and it's pushed by the Centers for Disease Control because it is shown to increase the likelihood that somebody, again in these settings, increase the likelihood that somebody will have a condom, so have a condom on them,
right.
Utilize them,
right.
Be able to have one or find one, as well as I think there was another note that it actually decreases sexual initiation. So that may offer more time for somebody to consider, you know, whether this partnership is
like
something they're gonna
how you're
pursue.
focusing on the demonstrated effectiveness, because that's the same thing that our federal funding source focuses on. So when the regulations come down from the feds and they say this is what you can or cannot do with the funding, they're basing that decision on, for example, in providing medication assistance. We know that if somebody takes their antiretroviral medication 100% of the time, that they're adherent with that medication, that it's going to reduce their viral load and in turn reduce the risk of transmitting that to somebody else.
Right.
That's an evidence-based intervention.
Sounds great.
But there's so much more work to be done than there is federal funding will allow for. So in terms of getting to some of these nuances like stigma, like someone treating somebody living with HIV differently or discriminating against them simply because of their disease state,
Right.
those are the things we need help from the community with.
And that government can't do.
Right.
Because when you're speaking about cultural change, you know, what government can do, I think government's doing a pretty good job of what it can do. But the truth of the matter is that cultural change can't come from the government. Behavioral change at that level but I think that I'm giving my own bias, not a bias, but I think it's fact that AIDS is too complex for government to deal with by itself. And we have to bring in, you know, community leaders, but I think we need the facts. Up until this point, it's just looked at it, okay, if we teach people about using condoms, they'll use a condom, but it's too complex than that, because in fact, condoms just don't do it to the point where they call it safe sex. No, it's not safe sex. If it's only going to work 70% of the time, it's not safe. It may be a little safer, but how are we going to call that safe sex? So from a demographic standpoint or whatever, you know, public health standpoint, yeah, okay, it reduced the rates of transmission, but for somebody's daughter to say, oh, use a condom and then you're going to be safe, that's nutty. That's suicidal.
And again, I think that comes back to that full educational component as well, and I can tell and appreciate that you're very well educated on the topic. I spoke earlier about how the Planning Council does annual planning for services, but we also do long-term strategic planning.
Okay.
So we've recently created a new comprehensive plan for the entire area where we have various strategies where we're working to reduce the number of new infections, working to increase access to care for people living with HIV, and some of those strategies we need the community's help. Things like making routine HIV screenings in clinical settings happen regularly across many clinical settings. Things like reducing stigma, things like empowering people living with HIV, helping them to have a strong role and a voice in the community, sharing their stories, sharing what they've been through. Exactly.
Starting to take the medicine. Don't wait until they have full-blown AIDS. Start taking it. You know, the studies are showing as soon as you find out you're HIV positive, the earlier you take it, you know, the better.
Exactly. And then we offer a whole holistic continuum of care to be able to assist with their needs as well. So if they've got concerns around nutritional availability, the programs can offer food bank services to make sure they've got food to take with their medications.
Okay, we got 5 minutes. I want to focus on African-American females. Why are African-American females now, you know, flipped up, whereas before it was white, gay white males, but now we're dealing with heterosexual African-American females?
Well, with the spread of HIV, especially to the minority communities, what you also find by when you look at the disproportionately impacted communities is that they're dealing with a lot of poverty, there may be stigma and discrimination, untreated HIV infection. When you think about poverty and access to health care, your chance to be able to go to the clinic, access care, and have that relationship with the healthcare system is less likely. And so we may have a lot more untreated infection in this community, and maybe some high-risk behavior, putting the women at risk.
All right. Well, who are these women getting the HIV from? Is it's I would say it's homosexual males. More than likely, am I correct?
Well, one of the reports I have read
bisexual
indicated that that for African American females there may be more sexual partners within the same demographic. So African American males, and that oftentimes that there may be some history of incarceration with their partners, and then we see a high prevalence within formerly incarcerated populations. And that population, if African American female are choosing them as sexual partners may be contracting it. That might be the bridge.
Let me put that in layman's terms. African American men are going to jail at huge rates. High amount of men having sex with men in jails, i.e. rape most of the time. So black men are going to jail, getting raped most of the time for drug crimes when they're singled out to go to jail for drug crimes, when Caucasian males are using drugs at higher rates, but they don't go to jail. But African American males go to jail. The amount of rapes and beatings that happen at jail, particularly Orleans Parish Prison, the rapes and beatings, so they're getting raped in jail, man goes to jail, gets raped, end up with HIV, comes home, have sex with a heterosexual woman, all right, or he could be homosexual, but he had homosexual, I mean, he could be either way, but the woman ends up with sex, and that's what's driving the rates.
And then meanwhile, when we ask people why they've not entered care, they say they had other competing priorities. And when you think of the other competing priorities that an African American woman might have, taking care of her children, her work obligations, her community obligations, whatever's going on with her partner or partners, it can be, there can be a delayed period of time before they get tested.
No, watch this. She lives in a community where she might work in the food service industry where she really makes too much money for Medicaid but not enough money to have insurance, so she's uninsured. So she ends up not going to the doctor. And the same thing with the man coming out of jail, because obviously we're having problems with health care at Orleans Parish Prison and many of the prisons, and so they're not finding out whether they're HIV positive, let alone finding out whether they've been beaten, raped at all. So that's why we're number 5.
And that's exactly why it's so important that our community is able to have a medical home, that women are able to prioritize their own health care and well-being, make sure that they get the preventative screenings for HIV as well as other diseases they may be at risk.
But Louisiana stopped, and this has nothing to do with y'all, but Louisiana just blocked from receiving Medicaid money as a part of the Obamacare issue, so therefore we could expect to see the rates of HIV fly even higher because the contributing factors of poverty and less medical care are all.
Exactly, because if we want to truly improve our health outcomes in this community, we've got to make sure that people have access to affordable health care, and that includes making sure that insurance coverage is accessible, that it's affordable, and that it's going to meet their needs.
And statistically, for 18 to 24, what's that for African American females outside of, what's that, well, for males is outside of murder and traffic accidents, and same thing for African American females. HIV is the #1 killer.
That's right. And that's why it's so important, and we appreciate you letting us get this message out to the community for people to know their status, to be in care, that there's care and services available, and that the programs are here to be able to help people, and that working together we want to make a difference in the community and turn those numbers around, because that's unacceptable as it stands.
So if we're going to turn the numbers around, we need a major war.
That's right.
And a community call to action.
Call to action. And we can call you guys, right?
Absolutely.
And people that want to help out, and the number is
504-821-7334. We have a website that's at www.norapc.org. That stands for the New Orleans Regional AIDS Planning Council. All of our meetings are open to the public. We've got a wide network of community partners who support this work, and we don't have all the answers, but we try to do a good job of finding whatever answers somebody may be seeking.
But you guys are willing to listen.
We're happy to listen very much, and we love for people to get involved, and we want to encourage everyone to have a voice and take part in making a difference.
Awesome professionals. We thank you so much. We thank you. Just real key, the prison issue is major. We keep coming up with this over and over again. What's got to happen with the prison issue? Getting raped and beaten in jail, African American females, men on the down low, but it's affecting everybody. Hey, let's fight. Call to action. Do whatever you can. HealthIssues2010.org. Thank you.